Hair fall is a very common problem for both men and women. Alopecia or hair loss can be of two broad types, scarring and non-scarring. The non-scarring types like androgenetic alopecia, alopecia areata, and telogen effluvium are far more common than the scarring variants. In males, the most common cause of hair loss is androgenetic alopecia, also known as male pattern baldness. To counter it, there are two FDA-approved medicines, finasteride and minoxidil. These medicines will prevent further hair loss by arresting the progress of androgenetic alopecia. In females, the cause of hair loss or hair fall can be multifactorial. Along with female pattern hair loss, there may be other underlying causes like iron deficiency anemia, hypothyroidism, polycystic ovarian syndrome, postpartum stage, which can lead to hair loss. So it is important to treat those underlying conditions as well, along with the treatment for hair loss. Besides androgenetic alopecia, another common condition which affects us all is alopecia areata, which is an autoimmune disease. It appears in the form of coin-shaped patches of hair loss on the scalp, which may progress and lead to hair loss from the entire scalp or even the entire body. So based on the extent and severity of alopecia areata, it can be graded as alopecia totalis and alopecia universalis. There are various other causes as well for diffused hair loss, which includes telogen effluvium, anagen effluvium, hypothyroidism, etc. Unfortunately, once androgenetic alopecia sets in, it cannot be prevented. However, it can be kept in control with the right medication. Depending on the extent of hair loss, the treatment options for both men and women include oral and topical medication, platelet-rich plasma injections, and low-level laser therapy, among others. In cases where there is complete hair loss or baldness in a particular area, hair transplant is the only and permanent option. PRP injected locally has shown good response in recent findings. However, a healthy diet, proper exercise, sound sleep, stress control, and cessation of smoking too can help control hair fall. In aggressive cases of alopecia areata, oral steroids may have to be started. Injection triamcinolone given every 4 to 6 weeks intralesionally has shown good results. Topical steroids can be given daily for local applications. However, it's ideal you should not use them for more than 3 weeks at a stretch. For long-term treatment, topical tacrolimus is the preferred drug of choice. While some might suggest that good hair care products can prevent hair fall, the real use of shampoo and conditioners is basically to cleanse and keep the hair shaft smooth and shiny. They do not have much use other than cleansing the impurities from the scalp and hair shaft. In fact, there are various home remedies which promise to improve quality of your hair. Amla, eggs, onion juice, etc. may improve density and quality of hair to an extent. In case the existing hair has fallen off from an area and you are completely bald from that area, hair transplant is the only permanent solution. And it is basically the best possible way to make sure that whatever hair you are implanting stays. The transplanted hair, like I said, is permanent. However, if you have thinning and then the transplant is done, for the existing hair, it's best you use minoxidil and finasteride. Like I said, the transplanted hair otherwise is permanent. Sometimes hair loss can also be your own doing, and the condition known as trichotillomania, which is a psychological disorder. Here, the person has a compulsive desire to pull out one's hair. Behavioral therapy and certain medications could help you in the treatment of this condition. Either way, hair loss can be treated with medication or a transplant, and you should definitely contact a dermatologist to help you with the treatment options and help you understand your condition better.
To book an appointment with a cosmetologist or a dermatologist in your area, please visit www.skinandhairacademy.in.